It might sound a bit strange, but it's actually true. We are all running on hormones. Because hormones influence an incredible number of processes in our bodies. That is, for example, metabolism, growth, or even sexuality and reproduction. And this also means that if the production of sex hormones no longer works properly and stalls, it can lead to various problems. And this can actually also happen due to cancer or cancer therapy. But fortunately, in these cases, hormone replacement therapy can help to get this under control. But why is that even important? A good question which we want to answer in this video. To do this, let's now briefly recall what we've already learned from the video on how cancer therapy can affect the future fertility in children or teenagers. If you haven't seen it yet, feel free to catch up on it. Otherwise, here is a brief summary. Because cancer therapy can affect the organs but also areas in the brain responsible for reproduction and also the production of sex hormones. So in girls, these are primarily the ovaries, and in boys, these are the testicles. But it can also be that the ovaries or testicles are not directly damaged. Certain areas in the brain can also be affected, and these areas are responsible for telling the ovaries or testicles to produce hormones. So a disruption can also occur here, for instance, if the head is irradiated. And all of this can lead to a drop in hormones, that is, estrogen levels in girls and testosterone levels in boys. Either because the ovaries or testicles themselves no longer work properly, or because the control in the brain no longer functions correctly. And the resulting hormone deficiency can then have a negative impact on various areas. This can be the sexual life, the metabolism, or even general well-being. Sometimes this condition is only temporary, but sometimes it is permanent. And how much someone is affected always depends on their age, the type of treatment, and the dosage. So, okay, that should make it clear why hormone replacement therapy can be important in some cases. But how do you actually find out what the status of your own sex hormones is after cancer therapy? It's quite simple. Only a blood test is necessary. This way, it can be determined if enough hormones are being produced for the person's age or if hormone therapy is necessary. For patients who are at risk of hormonal imbalances due to their cancer treatment, hormone status is therefore routinely checked during follow-up care. And exactly the same applies to everyone whose puberty does not start on time. The good thing is, if a hormone deficiency is detected, something can be done about it, namely in the form of hormone replacement therapy. The body then receives from the outside what it can no longer produce itself or can no longer produce sufficiently. The treatment can take the form of tablets, or also injections, hormone patches, or gels, which are then applied to the skin. Puberty can then proceed quite normally. In boys, the shoulders get wider and the voice deeper. In girls, breasts develop and hips become rounder, and everything else that goes along with it. Sex hormones are not just there for the body to change externally, though. They are also important for the blood vessels, bone structure, and muscle formation. In girls, it's even a bit more complex, because hormone replacement therapy can be also important to prevent young patients from entering menopause prematurely after cancer therapy. Otherwise, due to the hormone deficiency, it can happen that the ovaries stop working too early so that periods stop and you can no longer get pregnant. Normally, this only happens at around 50 years of age. Whether and when this happens as a result of cancer therapy depends once again on the type and dosage of the treatment, and also on the condition of the ovaries. It is important to know, though, that hormone replacement therapy can do a lot, but not everything. And we also need to talk briefly about that, because it can happen that the ovaries or even the testicles are so severely damaged by cancer therapy that they can no longer produce any or enough eggs or sperm. Then it is no longer possible to have children naturally later on. This circumstance cannot be reversed by hormone therapy. But it's important to know that there are medical procedures to protect fertility as best as possible before and sometimes even during cancer therapy. We've made 2 videos about this, one on preserving fertility in girls and one on preserving fertility in boys. There we introduce the exact procedures to you. So, and with that, we've already come to the conclusion. You now know that sex hormones perform important tasks in the body. They ensure that puberty proceeds normally and that you can have children, and beyond that, they also contribute to general health. If a hormone deficiency occurs due to cancer therapy, this can be compensated for with the help of hormone replacement therapy, so that certain body functions controlled by sex hormones run normally again. And if you want to know more about the topic now, for example, which causes are treated with which hormone therapies, you can take a look down in the video description, because there you will find further links that will help you learn even more about it and services to answer your questions.